how you define sensitization? It is the increased response. Always sensitization is increased response to same dose with repeated exposure. Desensitization is the opposite of the sensitizations, where we will have the decreased response to the same dose with repeated exposure. So when you will desensitization is useful when we use desensitization process. An idea? In case of allergy, if there is no alternative treatment available to treat the condition, and you want to use the same drug, then you desensitize the patient with that drug, with the smaller administration of the drug, with the repetitive administration of the drug to the same patient. What do you mean by drug-drug interactions? One drug affects the response of the other drug, which can lead to lack of efficacy. It can lead to increased response or decreased response. Both are harmful to the patient. Similarly, we have drug-food interactions, drug-alcohol interactions, etc. What is the cumulative effect?
So, accumulation of drug in the body.
Because the cumulative effect is because of the accumulation of drug into the body. It is the condition in which repeated administration of the drug may produce effects that are more pronounced than those by the first dose. It's called the cumulative effect. What is additive effect?
Combination of two drugs.
The combination of the
effect is
more to the additive effect.
If the effect of two drugs is more than the additive effect, it's called the synergistic effect. Antagonistic effect. The effect of two drugs taken together is less than the sum of their separate effect at the same doses. It will block, one drug will block the effect of the other drug. It's called the antagonistic effect, either completely or partially. Why we need to study all these different types of effects? Drug interactions and the pharmacokinetics, pharmacodynamics properties of the drugs, and also the different additive effects, synergetic effects, cumulative effects. Why we need to have this introduction for the pharmacovigilance with respect to drug safety? Because why?
Adverse reactions.
Adverse drug reactions may be associated with these effects. So whenever you have the patients, you need to evaluate the patient therapy in order to understand what are the different effects that can be produced if the patient is taking multiple medications, or the patient is suffering from the different medical conditions in which you are administering the products. As we discuss, our product will be, we study our products in a adult populations. We will exclude most of the disease conditions which our product may not be exposed during the clinical trials. But we need to understand all other possibilities at different environment when the drugs reaches the market. So here, as we discussed, the when the drug is approved, the MAH, which is the marketing authorization holder of the product, which is the license holder of the product, will not have any command on the prescription of the product. It is the doctors or the physicians who prescribe the drug to their patients, and they can prescribe based on their clinical judgment or based on their decision where the drug suits best to the patient. So we don't have any control on the prescription of the medications. Whereas in clinical trials, the marketing authorization holders define the patient who has to take who has to take the medication, the investigational drug, through the inclusion criteria and the exclusion criteria. So here, once a drug is marketed, our drug get exposed. That's why we need to understand different properties of the products, including the pharmacokinetics, pharmacodynamics, what are the different factors or the different effects, in order to track the behavior or track the efficacy and the safety of the product when it is used after the marketing of the drug. It's not only the pharmacokinetics and the pharmacodynamics properties which will affect the usage of the product, or it's also related to the patient behavior. Whether, because most of the times we go to this doctors, sees the doctor, and doctors prescribe the medications. And when we take the medications, we take the 1 or 2 doses of the medications, especially with the antibiotics. And once we get feel well after taking this medication, we stop that, which is more dangerous in case of the antibiotics, which can lead to the drug resistance. And the same drug may not work for you when you take again the same drug, because the body may have been developed the resistance to this product. So these all possibilities we need to understand when you work as a pharmacovigilance officer, or when you work in the pharmacovigilance field. So pharmacovigilance here is defined as the science and activities related to the detection. Okay, we need to identify what are the various factors that can affect the performance of your product, and which can harm either benefit the patient or harm the patients. For example, if your drug is benefiting apart from the approved indication, then also you need to capture those informations. Or it is harming your patients, again also you have to capture those informations. That's why we need to identify, we should have the knowledge and capacity to identify various side effects, adverse reaction, which is known and also which is unknown, and also the medicine related problems, which are the risk factors to this to the adverse drug reactions. Then also we need to assess how it has been caused. What may be the reason? Here we will check the dose. We will check the rationale for prescribing these medications. Here you will check whether the drug has been prescribed to a right patient, right dose, right frequency, for the right indication, right time, and you have the right documentation of the product prescription. Okay, and we need to monitor the patients. So, and also you will understand, when you assess, you will understand why this side effect or the medicine related problems or the adverse reaction have been occurred, and you will take a possible relative action in order to prevent these adverse drug reactions or medicine-related problems. If you cannot prevent, at least you will take the actions to minimize this, to minimize the harm or to minimize the occurrence of these medicine-related problems or harm to the patients. So this is the basic concept. We need to understand the different properties of the drugs and also the patients in order to prescribe the right drug to the right patients. That's called the rational use of medication. Got it? Any questions? Yes? Any questions? What are the different mechanisms for drug antagonism? Yeah, what are the different mechanisms involved in drug antagonism? Yes? Different mechanisms involved in drug antagonism. How we will categorize the mechanism for drug antagonism?
Some of them are it fully blocks or catalyzes the reaction. Some of them partially blocks.
Okay.
And then the competitive ones, non-competitive ones.
Based on the response, how you will categorize? Based on the properties of the drugs and the response. At the receptor level. You have pharmacologic and antagonism, chemical antagonism, pharmacokinetic antagonism, and physiologic antagonism. Can you give the example of the pharmacologic and antagonism? Example is propranolol and norepinephrine. What is norepinephrine? Yes?
It's a non-adrenaline.
Noradrenaline. Norepinephrine, epinephrine, adrenaline, noradrenaline. It's the adrenaline is the life-saving medications. You will use these medications in do or die situations. So here, propranolol and norepinephrine will have the opposite actions. That's pharmacological actions. That's called pharmacologic antagonism. Then chemical antagonism. How we define that? Can you give me the example? Which example we discussed? Chelating agent. Which is a chelating agent for heavy metal poisoning?
Poisoning.
Yeah, which is a chelating agent for heavy metal poisoning?
Dimercaprol.
Dimercaprol, which is an antidote for heavy metal poisoning. Then also we discussed about the pharmacokinetic antagonism. Here, either you will have the enzyme induction or the enzyme inducer or enzyme inhibition. So here we discuss examples of the phenobarbital, which is the which is the enzyme inducer, which will increase the metabolism.